Good morning, everybody. My name is Gabriel Spitzer. I'm part of the communications team here at Public Health Seattle and King County. Thanks for joining us in this new and exciting time slot for our briefing with Dr. Jeff Duchin, Health Officer for King County. We will have some time for Q&A after Dr. Duchin's briefing. Please use the raise your hand function in Zoom if you have a question, and we'll call on you. And with that, I'll go ahead and hand it over to Dr. Duchin.
Thank you, Gabriel, and welcome to everyone who's joining us this morning. I'm going to start with an update on our extreme heat event and then transition to the COVID update. The King County Medical Examiner's Office is now reporting 13 heat-related deaths and 2 drownings between June 29th and the 30th, all related to the recent heat event. This event has had a profound impact on our regional healthcare system. On Monday, the 28th, there were 226 emergency department visits alone. And the number that have occurred during this event have been between 4 and 25 times what our most recent daily high number of emergency departments visits have been for heat. And 30% of those cases have been admitted. Now, we've also seen a tremendous impact on our emergency medical system response for heat-related illnesses. The number of emergency medical system responses just during this recent heat event almost equals the total from 2018, 19, and 20 combined. We saw 370 EMS responses between Saturday and Tuesday, and there have been 425 in the years of 2018, 19, and 20 combined. If we look at the number of heat-related illness responses this year to date, it's basically the same as those 3 years total. Our healthcare facilities are seeing a high volume of sick patients, which resulted both in a stress on emergency responders and our area healthcare facilities. And the cumulative impacts of this heat event are hard to measure, but won't be apparent for months to come. Now, this event abruptly shifted our attention away from the COVID-19 outbreak, where we've all been appropriately focused, to an even bigger and more serious long-term crisis, which is the health impacts of climate change. Climate change is causing an increasing frequency and intensity of heat waves and other extreme weather events. And this recent heat wave should not be thought of as an anomaly, but the new normal, based on the amount of global warming that has already occurred. And we all need to be prepared, therefore, for increasingly severe weather events and their impacts, because the health and economic consequences of climate change are only projected to worsen. That's because even if all human emissions of heat-trapping gases were to stop today, Earth's temperature would continue to rise for a few decades as ocean currents bring excess heat that's stored in the deep ocean back to the surface. Climate change has been recognized by healthcare providers and public health authorities as a health emergency, and reducing greenhouse gas emissions is literally a matter of life and death. There's also a large overlap between the neighborhoods and communities of color that are at highest risk for heat-related impacts and those that have been hardest hit by COVID-19. Impacts of climate change on health are strongly linked to community vulnerability and resilience. In particular, pre-existing health conditions and living conditions. And in the US and in King County, we know these differ by place, race, and income due to inequities in distribution of money and power, historical disinvestment in communities, discriminatory practices and policies, structural racism, pollution burdens, and fewer access to healthcare resources. And as a result, low-income communities and communities of color are disproportionately impacted by the effects of climate change. I'm going now to transition to the COVID update, and we can speak more about what we need to do about climate change in the Q&A. I'm also doing away with the weekly COVID weather forecast analogy for now, because we're in a relatively stable situation with respect to short-term fluctuations for the time being, although our long-range forecast is still hard to predict with certainty. It's great news that our new cases and hospitalizations have been decreasing since early May. Over the last 7 days, we've seen 61 cases reported daily, which is down from 79 last week, and about 68% lower than last year at this time. And our COVID-19 cases are decreasing for all age groups, although the highest rates continue to be in children and young adults, followed by middle-aged adults. And COVID-19 is falling throughout the county, although it continues to spread at the highest rates in the same cities that have been hardest hit throughout the pandemic, in South King County, South Seattle, and Southeast King County. Our hospitalizations did bump a little bit from 29 to 40 last week, but remain relatively low compared to earlier in the pandemic. And they've decreased about 75% from our April peak of 23 a day to approximately 6 a day recently, which means one person in King County is being hospitalized for COVID-19 every 4 hours. So clearly this health threat is still with us, and we'll be watching the hospitalization trends closely to see if this is just a fluctuation that's short-lived or a new pattern that we need to understand better. Our 7-day hospitalization rate currently is 1.4 per 100,000, and our positivity rate is very low at 1.3%. We continue to see about 1 death daily, which is comparable to what we reported last year at this time. And in the last month, our incidence rates have been decreasing among all race and ethnicity groups, although our disparities continue to be comparable to what we saw throughout the course of the epidemic, with higher rates in people of color and among our Hispanic and other ethnic groups, including Native American, Pacific, Alaska Natives, and Pacific Islanders. Now, while the counts and rates have been decreasing for all race and ethnic groups, the rate of decrease for our Black African American community members has been less steep compared to the other race and ethnicity groups. Let me transition now to talk a little bit about vaccines. As you know, vaccination remains our best tool for emerging from this pandemic. 95% of our recent cases, 95% of our hospitalizations, and 95% of our deaths are in people who are not fully vaccinated. It's tremendous for our community that 72% of King County residents aged 12 years and older have completed their vaccination series, and almost 80%, 78%, have at least 1 dose. And for our 16 and older population, 73% have completed the series and 79% have started it. So we are in very good shape compared to many other communities in the country, but we still have gaps that we need to address and much progress that we can make. Our completion rate among our Black community members is 53%, and it's 55% among our Hispanic community members, compared with 67% among whites. Now, it's great that all of our racial and ethnic groups have over 80% completion with 1 dose or more. Oh, let me rephrase that. Have over 80% of residents with 1 dose or more who are 50 years of age and older, and over 90% of those who are 65 and older have received 1 dose or more. So those are phenomenal numbers, and we need to have everyone who started that vaccine series complete it for full protection. And we continue to see the gap in South and Southeast King County, the same areas that have had the highest COVID rates, with lower vaccination rates as well. So for example, 58% completion rate in Auburn, Kent, Federal Way, 63% in Southeast King County, 66% in Burien, Renton, Tukwila, SeaTac, and this is compared with over 70% with in the other regions of the county. So these are very good numbers comparatively if we compare ourselves to other parts of the country. In fact, King County has the highest vaccination completion rate of any comparably sized county in the country, but there's clearly a number of people who have not yet taken advantage of this life-saving and disease-saving vaccine. So we're looking forward to trying to make that vaccine available to all who can take advantage of it. Now, much of the success that we've had is due to our remarkable collaborators in the community, our healthcare providers, our public health team, and everyone who came forward to get vaccinated. We do want to reach a minimum of 70% fully vaccinated across all racial and ethnic groups and all zip codes, and ultimately have as many people that are eligible get the vaccine as possible. And we're currently focusing our strategy, refocusing our strategy to try and achieve this goal through a micro geographic focus in which we'll work with community partners and healthcare providers to concentrate and coordinate vaccination resources and outreach in neighborhoods and communities where we're seeing low coverage rates currently. And we're beginning to increase our ability to bring a more comprehensive whole person approach, including COVID-19 prevention through vaccination, but also addressing other health needs that are priorities for our community members, such as broadening our vaccination events to include health insurance enrollment, information about food assistance, and cancer and dental screenings. And this is really important and valuable to our communities that have traditionally received lower levels of investment from us in the community in their health and well-being. We're also going to be working with community partners to tailor our approaches to specific population groups and sectors, such as youth who have more recently become eligible, people living homeless, and older adults and people who have disabilities and are homebound. Now, with respect to our variants of concern, vaccination is more important than ever as more contagious variants become more widespread. From test samples collected during the 2-week period ending on June the 7th, we have sequencing information for about 20% of cases, which is a very good number. Of those sequence cases, variants of concern were representing 90%. So the vast majority of COVID-19 viruses in the community are variants of concern. And of those variants, we're seeing an increase in the Delta variant that is most noteworthy in the last 14-day window. The Alpha variant, which is the B117, has fallen to 49% of the variants of concern, no longer a majority. Delta has increased to 26%, and Gamma, or the P1, is 24%. So we're seeing Delta rising the fastest, and we expect that to become the most prevalent variant. And this is a highly contagious strain of COVID-19, and it will be challenging us over the next several weeks to months as it spreads more effectively than the previous variants. So getting vaccinated and getting both doses of an mRNA vaccine on time is even more important than ever if you want to protect yourself against COVID-19. Now, it's very important, again, to understand that the vaccines offer excellent protection against Delta, but the complete series is required. So if you want to be protected, please remember it takes 5 or 6 weeks after the first dose for full protection. Waiting to get vaccinated until Delta takes over as the most prevalent variant is not a good strategy. Get vaccinated now. Sooner is better than later to get the best protection. I also want to address questions we've been getting about the need for booster doses. Will there be a need to get a booster for COVID-19 vaccines? The total duration of protection of our current vaccines is not known with certainty. It could range from many months to years. And if the level of protection decreases, a booster dose will likely be recommended in the future, but we don't have evidence of that currently. Both public health and medical experts are closely monitoring how well the vaccines protect over time, and in particular as new COVID-19 variants of concern emerge, to understand if or when booster doses may be needed. But at this time, protection from 2 doses of mRNA vaccine, Pfizer or Moderna, or 1 dose of Johnson & Johnson continues to be high, and no booster doses are currently recommended in the United States. Now, of particular concern is the issue of high-risk populations like immunocompromised people, some of whom may not develop protection after the recommended vaccine series. And it's likely that any recommendation for additional doses would first come for these groups. Now, another question we've been getting is, can you get an mRNA vaccine after you get a J&J vaccine? Will it provide additional protection? And there is laboratory research that suggests that receiving more than 1 dose with a different vaccine formulation may provide benefits. And studies of this strategy are underway in human volunteers. It's possible that a combination of vaccines or a second dose of J&J vaccine may be recommended in the future. However, according to CDC, right now, there is no real world data to suggest a second shot is needed after J&J. and they're continuing to evaluate the need for a possible booster. So right now, no boosters, and in fact, our healthcare providers who are administering the vaccine sign a contract that it requires that they are adhering to the FDA's emergency use authorization and how vaccines should be used. So they really don't have the option to administer boosters in the US currently. Now I'll transition to reopening and the end of the mask directive. And as you know, Washington State lifted COVID-19 restrictions yesterday for most activities, and our local mask directive ended this week as well. So there are no longer mandated restrictions on the number of people who can be in most indoor spaces or how far they must be spaced, with the exception of very large indoor events with more than 10,000 people. With over 70% of our residents fully vaccinated, the local mask mandate ended on the 29th. And what that means is anyone who's not fully vaccinated is still required to wear masks in indoor spaces, according to Washington State guidance, consistent with CDC guidance. And it's really important to understand that even vaccinated people may choose to continue to wear masks if they're at risk for severe infection, or they have close contact with someone who's at high risk, or they just want to support mask wearing by unvaccinated people, or they feel more comfortable. They want to maximally reduce their risk given the increasing number of highly transmissible variants. They have that every right, and it's reasonable to continue to wear a mask, particularly in crowded indoor air spaces where people will be spending time. Businesses and workplaces can also require customers and workers to wear masks, and some vaccinated people may choose to continue wearing a mask if they're at increased risk for severe infection. Now, we're in a much better place today, as I've said previously, than at any time since the pandemic started, thanks to our highly effective vaccines and mostly thanks to everyone who's been vaccinated. And that is the way we'll return to the healthiest lives and the healthiest economy. But clearly, COVID's not over. And as we begin to get back to the activities we've missed so much and consider our own risk tolerance, it's still advisable to get vaccinated if you are eligible and encourage others to be vaccinated. When more people are vaccinated, each of us is better protected. Also, continue to keep a good quality, snug-fitting mask with you and wear it when asked. People who are unvaccinated need to continue to wear masks in indoor public spaces. And again, any business or organization can continue to require masks for customers or visitors. It's critically important that we pay attention to improving indoor air ventilation, air quality, and filtration. We know how easily this virus spreads indoors, especially in crowded spaces. And businesses and all organizations with indoor facilities need to take steps to improve indoor air ventilation and filtration. And of course, outdoors remains better than indoors for gatherings. COVID spreads much more easily indoors than outdoors. And remember, please, if you have symptoms of COVID-19 or you've been exposed to COVID-19, the virus is still spreading, still presents a risk. Please get tested promptly. Please isolate yourself if you have symptoms and quarantine if you've been exposed. So with that, I'll pause and welcome your questions.
Thanks so much, Dr. Duchin. For our Q&A, if you have a question, again, please go ahead and use the raise your hand function in Zoom, and we will call on folks. Our first question comes from Meher Graywell. Meher, please go ahead once I unmute you.
Okay, hi, Dr. Duchin. I'm Meher Graywell from Worth a Shot, and my question is, with the mask mandate for the vaccinated lifted in Washington State and some restrictions lifted as well, what do you predict in terms of the return of other respiratory viruses like the flu, and how do you think this might affect tracking of COVID cases? And also, as the pandemic comes under control, do you think that COVID-19 will have yearly outbreaks like the flu?
Okay, thank you for those questions, Meher. The measures that we put in place to interrupt the spread of COVID-19 profoundly disrupted the spread of other respiratory viruses as well. There were major restrictions on international travel, so viruses couldn't move around the world the way they usually do, and people were not interacting with one another the way we usually do. We were staying home and minimizing our interactions. We were avoiding crowded indoor spaces. Many spaces were closed. Many children were out of school environments where respiratory viruses frequently spread readily. And we were wearing masks, which are very effective in interrupting the spread of respiratory infections. We're now beginning to see those infections again reappear in the community, and we would expect that our usual respiratory infections, the many viruses, including influenza, adenovirus, parainfluenza viruses, respiratory syncytial viruses, and rhinoviruses, among others, will again start to spread from person to person. So that will present a bit of a challenge in that sometimes those symptoms from those viruses appear to be similar to the symptoms of COVID-19, which may lead more people to be tested for COVID-19, which is appropriate. But at the same time, we also learned that if we choose to wear masks and follow precautions that we used for COVID-19, such as minimizing time in crowded indoor spaces, we can reduce the spread of these other diseases as well. But I do expect that they will return to pretty close to their baseline levels of spread by this fall. Now, it's a little bit unclear what's going to happen with influenza viruses. There were previously four circulating strains, and we'll see which ones may reemerge and which ones may not going forward. But again, to the extent that people choose to wear masks, even if you're vaccinated for COVID-19, you may realize some health benefits in reducing your risk of acquiring influenza and other respiratory viruses when they are circulating. With respect to what's going to happen with COVID-19, it's a bit of a mystery right now. This is a new pathogen. It recently emerged. We don't have a lot of experience with it. Variants continue to develop, which spread more readily from person to person. Theoretically, in the future, they may evade the protection from our current vaccines, requiring vaccine boosters or changes in vaccine formulations. And over time, people will either get vaccinated or get COVID-19. The virus will most likely make its way to most people if they're not vaccinated. I do expect that, as we increase our activities, there'll be more opportunities for COVID-19 to spread. And that will probably lead to increases in cases and hospitalizations. But whether and when that becomes a more seasonal phenomenon will depend, I think, a lot on how many of us get vaccinated and how many of us develop natural infection and how the virus evolves. I do think ultimately COVID-19 will be comparable to the other human coronaviruses in that it will circulate widely in the population. And after enough of us have vaccine-induced immunity or have been infected, it will cause seasonal outbreaks as opposed to the type of disruption that we're seeing now with large numbers of people who are hospitalized and who died during the emergence of this pathogen.
Thank you, Dr. Duchin.
Thanks so much. Our next question comes from Evan Bush.
Hi, Jeff. Thanks for taking questions. Are you expecting to learn of more deaths from the acute impacts of heat in the coming days? Perhaps people still in their homes who have perished. What role will public health take in studying and understanding the overall toll of the heat wave, including excess deaths? And then what more could have been done by government to prevent the loss of life with this event?
Yeah, thanks for the questions, Evan. So I think it's possible over the coming days we'll learn more, we'll be able to more accurately understand the health impacts of this recent extreme heat event. Over time, there may be people who are still in the hospital, for example, who are critically ill, who may die, and I think there may be better, more sophisticated analyses that can be done to look at excess deaths over what would have been expected during this time. So we will be internally looking at the data that we have both from the King County Medical Examiner's Office, from our area healthcare facilities, and in collaboration with researchers at the University of Washington, trying to put together, the best picture of the impact, the health impacts of this extreme heat event, both in King County and in Washington State. It can take a while to understand all the different health impacts. For example, extreme heat can cause, of course, heat stroke and heat exhaustion, but it can also cause death and illness due to exacerbating cardiovascular disease, so heart attacks and strokes. It can worsen pulmonary disease like asthma and chronic obstructive pulmonary disease, and it can cause exacerbations of renal disease. And so it takes a while sometimes to understand exactly, which health outcomes have resulted from the heat event, and understand how many of those are due to heat versus would have occurred in the absence of heat. So those types of analyses take a little while and have to be done very carefully. So I do anticipate that over time, the health impact, as we understand it, will be most likely higher than we think it is today, and we'll have a more precise understanding of the full spectrum. There's also, of course, stresses to mental health and well-being that are also very hard to measure precisely, but we know that extreme heat and heat events lead to mental health pathology as well. Let's see. With respect to preparedness, this is an important question, because, as I said, these types of events are to be expected given the amount of global warming that's already occurred. And even if we stopped everything today with respect to greenhouse gas emissions, our temperature would be expected to rise. So these types of global temperatures will continue to rise for decades. So these types of events are only going to become more frequent, which means we have to do two things. We have to be better prepared for them, and there are a wide range of events. It's not just heat events, but there's other extreme weather, such as floods, droughts. There are vector-borne, foodborne, waterborne infections, changes in the quality of air, air pollution, ozone, and then impacts on the food and water supply, and then the mental health and behavioral health impacts. So we really do need to be prepared both for adapting to this new reality and expecting these types of events and having resources in place. So in the context of this specific heat event, what can we do to better prepare our communities to withstand similar events in the future? Well, there's the issue of air conditioning, the issue of adequacy of the volume of cooling centers, the underlying vulnerability of the population, what can be done to make people more resilient and communities more resilient with respect to their baseline health, and so on. So we'll need to take a close look at how well we did here, and what opportunities we missed, and whether we need to fortify our defenses in the future against similar events that should be expected. There are also more actions that are necessary to now stop the emissions of greenhouse gas, so we don't see even more catastrophic health impacts going forward. If we stopped everything today, we'd still have to grapple with what the warming that's already occurred and the significant impacts on health and well-being that we're going to experience. However, if we allow global warming to continue, we should expect ever more dire impacts on health, safety, and our economy. And so we also need to do everything possible to decrease greenhouse gas emissions going forward.
Thanks, Dr. Duchin. Evan, did you have a follow-up? I see your hand's still up.
Oh, sure. Yeah, I'd just be interested. For this specific event, were there enough cooling centers? Were there enough places for folks to go? And, is there anything, given what you know of the folks who have who have died in this event or become admitted to the emergency department, that there's a commonality or something that you see that could have been addressed differently?
Yeah, those are all questions that we need to answer, but I think that it's a little bit too soon for me to say. This is sort of these are the type of questions that we routinely ask during after action events, and we'll be doing this very carefully, not only within public health, but with our emergency management partners and our partners in local government. And so those are very important questions that need to be asked, but I don't think I have the answers today. It's too soon. This will take some time to understand again the full impact, and then what of that was preventable. So stay tuned, because those are critically important questions that we have to answer.
And Dr. Duchin, what do we know of homelessness's role in the folks who have perished or who have become admitted to the emergency department? Is that clear in the data?
I do not have data on that. It's another thing that we are trying to better understand at this point. Both, the role of homeless or living unsheltered outdoors, or living in unstable housing, and again, the factors that we already understand, the predisposing factors related to baseline disadvantage, socioeconomic disadvantage, and the heat, the heat islands and the heat maps that you recently saw Seattle Times published, that were produced by Department of Natural Resources. These are known predispositions to adverse health outcomes. But I have not seen the data yet on the breakdown of demographics or risk factors among those who suffered from heat-related illness. And part of that is, we really need to first understand that everyone who's been impacted, who they are, which conditions are due to heat, and then study those populations. I think the King County Medical Examiner's Office could provide information about the 12 deaths, and it's possible our communications team know more about those than I do today. But I don't think that information has been compiled yet, because we're still, as I said, trying to understand more comprehensively the full spectrum of health impacts that occurred.
Thanks so much. One small point on that: the medical examiner's office reports that one of the decedents from heat-related illness was presumed homeless. So one of the 13 so far. Our next question comes from Eilish O'Neill. Eilish, please go ahead.
Thanks for taking our questions. My first question is related to this question of protecting vulnerable populations from the heat. I was curious what steps Public Health Seattle King County took in this last heat wave to protect the vulnerable, and particularly the elderly, if there's any outreach to those who couldn't access cooling centers on their own, for example. And my second question is in terms of the inevitable wildfire smoke that we'll experience either this summer or in future summers. What proactive steps is the county taking to protect vulnerable populations from the smoke?
Yeah, those are great questions. Thank you. And I think I can give you a general answer, but we'll need to follow up with you with specifics, because the steps that are taken both to protect from extreme heat and to protect from wildfire are done in collaboration with our city governments and emergency management centers. So for example, for the heat, and one of the challenges with the heat is, you don't get a lot of warning for these heat waves, for extreme heat waves, but we work with our municipal, county, city emergency management agencies to reach out to Health and Human Services around opening cooling centers, and to connect with social service agencies that can communicate with their at-risk vulnerable clients to get them information on how they can stay cool, and to the people who are in contact with vulnerable clients to get them information on, checking on people, for example. So, if someone is at high risk, elderly, or has underlying medical condition, it's very important that they not be alone in these settings. So most of the work that we do is pushing out information around preventive measures to our partners in county and city emergency management and community service agencies that then connect with their clients and their populations. I think that it's possible that our emergency preparedness section has a comprehensive list of the actions that were taken that we can provide to you, but I don't have that handy. With respect to smoke, it would be similar. We, as you might remember, last summer during the COVID outbreak, when we were sheltering people who were exposed to COVID-19 in I&Q facilities, we had a smoke event that then provided some challenges, or presented some challenges to our team with respect to balancing the need to limit outdoor air coming in because of the dangers from the smoke particulates, and providing adequate ventilation and airflow to minimize the risk of COVID-19. And we had to make some major engineering adjustments to the facilities to do that. This year, thankfully, the COVID-19 risk is much lower, so we'd be focusing on shelters, smoke shelters for the community. And again, I don't have the information handy about the status of the capacity for smoke shelters, so we can follow up with you for the various municipalities about what's available and what's planned.
Thanks a lot. And Eilish, go ahead and reach out to PHPIO and we can try and connect you with the answers. Our next question comes from Michael Crow.
Hey, Dr. Duchin, thank you for doing this. I always appreciate you taking questions. One question on heat and one on COVID, which is the trend here, I think. On the state DOH call yesterday, they were kind of saying that they felt the risk of the variants was fairly controlled at a state level. I think the number they threw around for Delta and Gamma was something like 16 and 17% each. I hear you say that ours here in King County are looking a little higher, 26 and 24. I guess, is your concern higher for these variants in a populous county like King County, even though our vaccination rate is fairly high?
Yeah, I think with the Delta variant, the Gamma variant, and I think future variants are going to continue to present a serious challenge to us with respect to COVID-19 control. I'm very concerned about the recent rise of the Delta variant in particular, because it's rising rapidly worldwide. No other variant has done that so far. I think it's going to become the predominant variant across the globe, including in the US, Washington State, King County. And so what that means is that, if you're not vaccinated, you're going to be susceptible to a virus that is more contagious and moves quicker from person to person. And again, with these variants continuing to develop, there is always the threat to the protection that the vaccines provide, that they will, mutate in a way that that requires some adjustment to the vaccine, either a booster or a changed formulation to provide higher level of protection. We know that Delta reduces the level of protection somewhat from our vaccines, but the vaccines still are excellent for protecting against severe disease. So people may be more susceptible to getting a COVID infection, slightly more susceptible to getting a COVID infection, but still very well protected against hospitalization and death. So I feel that the variants are representing, a serious both short and long-term threat. And in particular, right now, I think the Delta variant in particular, because of the speed with which it's taking over the landscape of variants, is the most concerning. So again, this is really a threat for unvaccinated people. And that's why we need to continue to remember that unvaccinated people need to wear masks in public, both to protect themselves from getting COVID, but also from spreading it to others, and to take steps to limit their interactions in crowded indoor air spaces, and that we all need to do what we can to improve the status of the air, the ventilation and filtration in indoor air spaces to reduce that risk of Delta virus spreading to anyone who is unvaccinated, and to a small proportion, perhaps, of those who even are vaccinated. So yes, I think that the risk from the variants is significant. Now, that said, I don't think, based on the current situation, that we're going to see the type of hospitalization surges and death surges that we saw before we have vaccines. I think it's quite possible that we'll see additional cases, we'll see additional hospitalizations due to Delta and future variants. But because the vaccines are still so highly protective and are in particular, protecting those that are most likely to have serious illness and die, the older adults, that we're not going to see those massive spikes in hospitalizations and deaths. But we can see increases. I would not be surprised if we saw increases in cases and hospitalizations going forward. Only time will tell the extent to which that will happen, but I don't think it's going to be massive or comparable to what we saw earlier before in the pre-vaccine era of the outbreak.
Thank you for speaking to that. The other question I had, it kind of echoes Evan's a little bit here, but as you said, our new normal is climate change. We're going to feel these extreme events going forward. On the topic of government preparation for an extreme heat event like this, do you think if this is our new normal, we can prevent deaths in future heat waves, like completely prevent them, or will we start to see these in the summer in Seattle and Washington?
Well, we will start to see more and more extreme heat events. And of course, these are linked with fire and smoke. And as you probably saw, there are fires now breaking out in British Columbia and California, and we will most likely be impacted. And there are wildfires burning in Washington state as well. So, both heat and fire are going to present ongoing increasing frequency of extreme heat and fire and smoke events is our new reality. We need to expect that, and we can take significant steps to minimize the health impacts from those events. I don't know if we can prevent all deaths, but we can certainly minimize the risk by increasing preparedness through adaptation measures, such as providing more air conditioning, better green space through planting trees, which is part of the King County Strategic Climate Action Plan and other plans around the country. So reducing some of those heat islands, and then better preparing our communities for these events that occur on short notice that require facilities for people to seek shelter from either extreme heat or smoke. So all of this, I think, is going to be a work in progress as we come to confront the reality of the level of climate change that's already occurred and the significant health impacts that level of climate change is going to cause for us.
Thanks so much. We're going to wrap up the Q&A portion there. Dr. Duchin, I'll just throw it to you for any closing thoughts.
Thanks, Gabriel, and thanks to those of you who joined us this morning. I'm grateful for your joining and your sharing information about both COVID-19 and the threat of climate change with our community. Again, on the COVID front, really gratified that our situation is continuing to improve thanks to vaccination. And again, thank you to everyone who's taken advantage of these vaccines and been vaccinated to protect yourself and your loved ones in our community. But I also think people need to realize that even though we're reopening and our mask mandates for vaccinated people have been lifted, the outbreak is not over. And we're still in uncharted territory with respect to COVID-19 in general. This is a newly emerged virus that will continue to evolve and challenge us. And we should expect to see an increase in cases among the unvaccinated as more dangerous variants of concern spread. As we move into summer and towards fall and winter, there is uncertainty around the impact of our changing behaviors, on our reopening and our increasing activities, about the new variants of concern, the duration of protection from vaccination, and other things we really still don't understand about how the virus spreads. So should the course of the outbreak change in the future, we should be prepared for guidance also changing, recommendations changing. And again, the use of face masks may be necessary in the future. So please don't throw your mask away. And in fact, carry it with you wherever you go currently, because it may be required in certain settings. So we do continue to depend on one another for community protection. The more of us are vaccinated, the safer we'll all be. So thank you for all who are continuing to work with us to reduce the impact of COVID-19. And again, with respect to climate, this climate change is a recognized health emergency. It's not a controversial topic. It's been recognized by all our major medical professional organizations, public health organizations, and virtually every scientist that studies the issue understands that greenhouse gas emissions are causing global warming that is creating a major threat to human health and well-being. And this climate change really affects our health through not only heat waves, but through floods, droughts, and other extreme weather events. We'll be challenged by increasing infectious diseases, food and waterborne infections as well, vector-borne infectious diseases, and changes in the quality and safety of our air, of our food and our water. Also, potential impacts on infrastructure like transportation, electricity, energy, and so on, and stresses on our mental health and well-being. So I am encouraging everyone to do what you can to learn about this real risk of climate change, what you can do as an individual to help us both manage the consequences that we are already destined to experience, but also more importantly, for the sake of our children and future generations, to prevent the more catastrophic impacts of climate change that will occur if we continue to emit greenhouse gas emissions at the rate that we're currently doing it. So again, thank you for joining today, and look forward to continuing to talk to all of you about these topics and more as we go forward.
Thanks a lot, Dr. Duchin. That concludes today's briefing. Take care, everyone.